Prepare to try out for fall sports, and there are a few things parents need to keep in mind regarding the health of their kids, like making sure they have the proper footwear for their selected sport. Here with more on the topic is Dr. Leon Watkins with the Gulf South Foot and Ankle, and thanks so much for joining us. So it's
Glad to be here.
All about the shoes you choose, right?
That's right.
Give us some tips on what to pick.
So yeah, when you're buying a shoe, there's a couple things to keep in mind. You want one finger's breadth between the end of the toes and the end of the shoe. This allows the shoe is not too small and also allows some wiggle room for growth.
All right.
The second thing is you want to put your child in the shoe and look at them from the front and from the back. And the upper portion of the shoe, which is where the foot is located, should not bulge out over the outsole in this area right here. If it does, that shoe is too wide, or pardon me, too narrow, and they need to go to a wider shoe. A tight shoe will cause problems with chafing and blistering and so forth.
And they have wide width shoes available.
That's
in
correct.
A lot
Sometimes
of
they need to be special ordered, but they do have them often available in the store.
Okay.
The third thing is you want to try to go with a leather shoe or a fabric shoe. You want to stay away from rubber or plastic. Those materials do not breathe very well, and they cause they trap the heat and they trap the moisture, which can lead to blistering and rashes and that sort of thing.
All right, now once we have our shoes, there's certain things that the kids need to do before they actually try out, and that's all in warm-up, right?
That's right. So a lot of people, before they start their exercise routine, they have a stretching routine, but they often neglect their feet and their ankles. And your feet are the foundation of your body, and every time you take a step, your entire body weight goes through your foot, and it's very important not to forget this part of the body. There's two I recommend. One is the foot roll. Basically do large sweeping circles with your feet. This really essentially engages every muscle in both the foot and ankle and provides a really good stretch.
And then there's another one too where you actually lift up your heel, right?
That's right. That's right. Everyone's pretty familiar with this one. Basically, you stand up straight and you go up onto your toes and you come back down. Hold it for about 2 seconds. Come back down. This can be especially effective if it's done on a step or a curb, where you can dip your heel below the level of the ball of your foot, and really maximally stretch that posterior muscle compartment and the Achilles tendon, which is a common area of injury.
And another area of injury, we were talking earlier, the shin splint is what?
Shin splints is very common. That's especially common in runners, and that's basically an inflammatory process of the medial aspect of the tibia or shin bone. This is usually occurs from starting a routine too quickly, and so you really have to break into that slowly. That is what's on the screen now is something called calcaneal apophysitis. That's heel pain.
Yeah.
Also very common in children. Heel pain, a lot of people automatically think it's a condition called plantar fasciitis. Plantar fasciitis is also very common, but it's very rare in children. Calcaneal apophysitis, or Seaver's disease, is inflammation of the growth plate in the heel.
Wow.
And we see that in 8 to 14-year-olds.
Well, let's start first with the shoes, and then if you have a problem, you need to contact your doctor and see what's wrong with you. Thanks, Dr. Leon Watkins.
You're welcome.